But Spencer, thanks so much. We begin a new segment tonight on 13 News at 5, and we're calling it House Call with Dr. Assal. Dr. Assal is the medical director of cardiac electrophysiology at CAMC, and tonight he's going to possibly save someone's life. Now, we're talking about that flutter that you feel in your chest every now and then. It could be more than just a heart palpitation, right, Dr. Assal?
Right. Well, Patrick, there's a chance you might have something called atrial fibrillation, or AFib. And AFib is more common than you might think. It is estimated that more than 33 million people worldwide have AFib. And it is more common the older you get. So what is AFib? It is basically an electrical malfunction of the top chambers of the heart. There's something called the SA node in the upper right chamber of the heart. It sends electrical impulses, triggering each of the 4 chambers of the heart to pump blood at just the right time. In AFib, this normal electrical signal is taken over by chaotic electrical impulses that make the top chambers of the heart quiver. It can cause that fluttery feeling, irregular pounding, rapid heartbeat, or even chest pain. It can also cause blood to pool in one of your heart's chambers, where it can form a blood clot, which can eventually travel to the brain and cause a stroke. If you have AFib and do not treat it, your chance of having a stroke is 5 times higher, and you are at greater risk of developing heart failure. Some people have AFib episodes that come and go. Others have it all the time. Some have it but never experience symptoms. It is often discovered during routine physical when the patient undergoes an EKG.
All right, so Dr. Assal, now that we know the signs and symptoms, how do you treat AFib?
Well, there's somehow or somewhat an extensive list of ways that AFib can be treated, from medications to cardiac electrical shock therapy to invasive strategies called ablation. But regardless of how your doctor chooses to treat AFib, most patients would need to be on a blood thinner to prevent the risk of stroke. And Patrick, next week we'll be talking about a tiny device that can be implanted in the chest to detect AFib in stroke patients to see if AFib was the cause, so that treatment can be applied to prevent future episodes.
Looking forward to that. House Call with Dr. Assal. Thanks for joining us. We'll see you next Monday.
Thank you. See you next Monday.
And we'll be right back. Stay with us.
We always try to honor 9/11 in our hearts, and especially for the kids that don't remember.
Continues to define who we are as a country.
Good show.
Yep, thanks.
I look forward to rolling up my sleeves and getting to work.
Okay. Where am I? 3? Okay, cool. Yeah. At least I don't look sunburned at all. Just a little bit. My main man, Hophosaurus Rex, is the first conversation we had all day today. You're high and mighty now, I know. Yeah, I know. All those big timers out of Lincoln County. Yeah, you know.